Hello, Mrs. Mason. How are you doing today?
I'm doing fine.
It has come to my attention that you would like to know about your situation with your genetic disorder.
Yes.
Do you know about Marfan syndrome by any chance?
No, I don't really know what Marfan syndrome is.
All right. People with Marfan syndrome are usually tall and thin with long arms, legs, fingers, and toes. The damage caused by Marfan syndrome can be mild or severe. Marfan syndrome is an inherited disorder that affects connective tissue or the fibers that support and anchor your organs and other structures in your body. Most commonly affects the heart, the eyes, blood vessels, and the skeleton. It is also a single gene disorder. Now, Mrs. Mason, since you told me beforehand you and your brother have Marfan syndrome, here's what your pedigree would look like. Your mother is dominant and affected, while your father is the carrier, which leads to the both of you and your brother getting the genetic disorder. Now, what I'm about to show you next is, hold on a moment. Are the chromosomes affected by Marfan syndrome, also known as chromosome number 15? Hold on for a moment. Now, is there any concerns?
Yes. Will this impact my ability to play sports?
For your safety, yes, it will. Since this is a disease that affects the heart and eyes and blood vessels and the bones, and overall basketball requires a lot of physical activity, not to mention it raises your heart rate.
Another concerns that I have is if I decide to have children, will they be affected by it?
Yes. The reason why is because Marfan syndrome is an inherited as an autosomal dominant condition.
I see. My last concern for this is that, do I have a long time to live?
Despite the high risk for Marfan-related cardiovascular problems, the average life expectancy that you will have is nearly 70 years.
Oh gosh.
Now, would you like to hear what you can do? Because
yes,
this Marfan syndrome has no cure, just to let you know. Now, the treatment focuses on preventing the various complications of the syndrome. Medications. Your doctor can prescribe blood pressure lowering drugs to help prevent the aorta from enlarging and to reduce the risk of dissection and rupture. Another one can be therapy. The vision problems associated with dislocated lens in your eye often can be corrected with glasses or contact lenses. And more of these recommendations are going to focus on surgical and other procedures. The aortic repair. This can help prevent a life-threatening rupture. Your artery valve may need to be replaced as well. And then on the other one, scoliosis treatment, is when there's a significant scoliosis. A consultation with a spine expert is necessary. More more for breastbone corrections. Surgical options are available to correct the appearance of a sunken or protruding breastbone. Because these operations often considered to be, for cosmetic purposes, your insurance might not be able to cover the costs. Now, here's another surgery, the eye surgery. If parts of your retina have torn or come loose from the back of your eye, surgical repair is usually successful. If you have cataracts, your clouded lens can be replaced with artificial lens. Any final thoughts, Mrs. Mason?
Yes, hearing about this makes me feel very aware of what situation I am, and it also makes me feel very sad knowing that I only have about 70 years to live, but I will spend my time wisely with my family without any regrets. And thank you so much for your time. If I need any more information, I will come by again.
No problem, Mrs. Mason. And thank you for coming in for today.
Bye. Have a great day.
Goodbye, and you too.